The physical examination of a feline patient. Part 2. Patient signalment, history, and subjective observations. In Part 1 of this series, we discussed the importance of the physical examination as a diagnostic tool and thorough documentation being essential to the process. We will begin the exam with patient signalment, history, and subjective observations. Signalment. The first step in the complete physical examination is to consider patient signalment. Signalment is a complete description of the patient including species, breed, age, and date of birth, sex, and reproductive status, whether the animal is neutered or intact. This data may already be filled out on a computer-generated examination form, or they may be on the patient record. Verify that they are correct every time the patient is seen. Never assume that the client knows for certain the reproductive status of the animal without verifying a spay or neuter date of surgery in the patient history. Signalment is as important as clinical observations when determining a set of differential diagnoses. Patient history. The next step is to obtain and confirm the patient's medical history. It is important to establish the owner's primary medical complaint and document it on the physical examination reporting form. Note the symptoms that the owner has observed, the frequency and duration of the symptoms, and any contributing factors that will clarify the nature of the problem. Once this has been clearly established, a broader history must be taken. Taking history must include a vaccination history, viral status, past illnesses and ongoing symptoms, prior ownership and geographic origin of the pet, recent traumatic events, environmental and nutritional deficits, breeding history, and current medications that the patient is receiving. Dietary history is also very important. Note the pet's diet and dietary indiscretions. Document any recent changes to the diet and whether the pet has received table scraps. This information is often critical to a thorough patient history. Medication history is also important. Identify if the patient has taken any over-the-counter medications prior to the visit. Note if the patient is currently on any prescription medications. Identify if the patient has had any adverse reactions to medications in the past.
Ms. Boulay, I'm one of the technicians. I'm going to get a history and a weight on Gray, and then Dr. Norsworthy will be in to do his exam. Okay. In the computer, we have that he's a domestic short-haired kitty, and he's a gray tabby, which all that matches what I'm seeing. And we also have that he's a male neutered kitty. Is that correct? And we have that he's about 2 years old. Is that also correct? Right. Okay, excellent. And he's here today for his annual visit with his vaccinations, right? Okay, great. And does he go indoors, outdoors?
Indoor only.
Indoor only. Okay. And how's his appetite been since we saw him last?
Very good.
In the litter box, have you noticed any change in his stool?
No, they're pretty normal.
Okay. How about how much he's urinating in the box? Are the clumps really small or larger in size, or are you finding it flooded at all?
They're pretty normal.
Great. Is he on heartworm preventative?
Yes, Revolution.
And that also covers fleas. Is he currently taking any other medications?
No.
None at all. Okay.
Subjective observations of the pet. Keen observation skills are an essential component of the physical exam. We begin by observing the pet and his or her behavior from the moment they enter the exam room. This observation and general assessment will include the subjective appearance of the patient. Observe and record the pet's body condition. Check the coat for good grooming habits or an unkempt appearance. Symmetry of carriage. Check for any asymmetry of body shape and extremities. Proportion of size. The pet should be typical for the breed. Note any severe heritable anomalies in skeletal structure. Body condition scoring should also be assessed through keen observation and through feeling the pet's body. The body condition score can be evaluated using a 1 to 5 scale or a 1 to 9 scale. In this example, we use a 1 to 9 scale. 1. Emaciated. No fat over ribs, raised tailbone and peak of spine, severe abdominal tuck. 3. Underweight. Ribs easily palpable with minimal fat covering, easily palpable spine, abdomen tucked. 5. Ideal. Ribs palpable, tailbone smooth, peak of spine palpable, hourglass figure, lumbar waist. 7. Overweight. Ribs difficult to palpate, fat pad over tailbone, no abdominal tuck or lumbar waist, tube-shaped. 9. Obese. Rolls of flesh over neck, ribs impalpable, tailbone impalpable, pendulous bulge at abdomen, bullet-shaped from above. Observe the subjective hydration status. Increased skin turgor, and thus dehydration, is identified as a loss of elasticity when the skin is lifted and released. Skin tenting of the upper eyelids indicates significant dehydration. Observe and record the attitude and mentation of the pet. Record a change in personality or atypical aggression. Record the patient's mental status as bright, alert, and responsive, abbreviated as BAR. Hyperactive. Depressed. Dazed or disoriented. Comatose. These subjective attitude and mentation assessments will later be combined with the objective neurologic exam in the systems portion of the complete physical examination to help reveal any neurological deficits. Document any subjective characteristics of the patient during this part of the physical exam. It is not necessary, however, to document any negative answers to the questions we have discussed. For example, there is no reason to note that the patient was not comatose. Let's follow Dr. Norsworthy as he performs a physical exam on a feline patient.
The first part of my physical exam is to just get a good look at the cat in general. So he needs to come out. Thank you very much, Mr. Gray. And what I'm doing now is looking at his general attitude, at the brightness of his eyes, how he responds to me. I'm feeling to see if he's dehydrated by picking up his skin like this. I'm also feeling his muscle structure along his spine, which allows me to determine what we call the body condition score. The body condition score that we use is based on a scale of 1 to 9, and 5 means it's perfect. Anything less than that, the cat's a little thin. Anything more than that, the cat's a little too heavy. And I would give him a body condition score of about a 4. He's pretty well fleshed, but he's fairly thin through here.
In Part 3 of this series, we will record the patient's vital signs,